is Daddy Fred. You welcome to the show here on the Announcer Newspaper. You can share the video so your friends will have opportunity to be part of the program. My name is Daddy Fred. Today we're going to look at the outbreak of coronavirus. Very sad indeed. What is going on now? According to report that we have, about 3,000 people have died globally. That means the whole world. About 3,000 people have died. This is very sad situation. This is very sad situation. Global death toll tops 3,000 coronavirus. Now, according to information we have now, Iran has reported nearly 1,000 cases. Iran, the country has confirmed 1,000 cases. So as a result of that, neighboring countries have gone as far as closing their borders to prevent the spread of a disease. Italy has also reported nearly 1,700. They've confirmed 1,700 cases and at least 34 deaths. Global problem. Coronavirus. It is creating problem in the whole world. It is bringing panic, fear among everybody. Protect yourself and others. Now, information that we've gathered, according to reports that we have now, has it that more than 88,000 people worldwide have now been infected with coronavirus. More than 88,000 people worldwide, the whole world, have now been infected with coronavirus. Several communities are under quarantine. Now, as I'm speaking now, in the United States, report that we have now also states that United States reports 88 cases. And out of the 88 cases, 2 deaths reported. This is a sad situation. Now, you may recall that, if you may recall, on Friday, there were 65 cases reported in the United States. And less than 48 hours later, a single hospital in Washington reported 2 deaths, making things very tough for the situation, very tough. And now we having it that about 88 cases have been reported so far in the United States. This is a sad situation. So one may ask this very important question. What is coronavirus? Coronavirus. People are talking about it. People want to know what coronavirus is. Coronavirus are common in people and many different species of animals, including camels, cattle, cats, and bats. So they are common in humans, they are common in some animals as well. Now, coronavirus was first detected in China and has now been detected in 60 locations internationally, including the United States. 60 locations internationally. It is becoming a sad situation. Now, it is something that people are confused now. They don't know where the coronavirus came from. They have been confused now. They are asking, what is coronavirus? I've given you details about how coronavirus, how the whole thing. Now we're going to talk about how coronavirus could be spread and the need to take precautions in your life all the time, what you have to do. And we're also going to talk about symptoms of coronavirus. If you see, so today, what we're going to talk about, more especially, we're going to also talk about the global breakdown, people who have been affected, people who have died, like I earlier indicated, and then symptoms of coronavirus. Symptoms, if you see that these symptoms are happening on you, then you need to take precautions very rapidly. You need to find solution to the problem. Now, before we go to the symptoms, let's look at how coronavirus could be spread and how it has been spreading all over the world. How COVID-19 spreads. Now, according to information that we have, person to person spread, meaning that the virus is thought to spread mainly from one person to another person. Between people who are in close contact with one another within about 6 feet. So if you are in close contact with one another within 6 feet, and you know this person has traveled to this place, this person is exhibiting these symptoms, I'll let you know more about the symptoms so you know the details about it. Then you take precautions. It is also spread through respiratory droplets produced when an infected person coughs or sneezes. So supposing you are having good time with a friend and the person is sneezing, the person is coughing, and if that person is infected with coronavirus, and if you are so close to the person, automatically you're going to breathe in the droplets, and it's going to create problem for you. You're going to inhale it, and these droplets can land in the mouths or noses of people who are nearby, or possibly be inhaled into the lungs. Has been another situation. So, in fact, we know that the spread of coronavirus is through person to person. If a person is having it and then you are closer to the person, at least you have to be 6 feet apart. If you are not 6 feet, if you are within 6 feet, it's going to create a problem. Now, the various symptoms of coronavirus, if somebody is having coronavirus, how would you know? Or you yourself, if you are having it, how would you know that you are having coronavirus? Because you can't know by looking at your own physique or how you look like. But the symptoms that you may be exhibiting will tell you that these symptoms are likely drawing my attention to something that I need to take steps immediately. Or these characteristics I'm experiencing are telling me something that I need to take proper steps. So, reported illness have ranged from mild symptoms to severe illness and death for confirmed coronavirus diseases. Symptoms may appear 2 to 14 days after exposure. So if you get exposure to coronavirus, symptoms may appear 2 to 14 days after exposure, according to CDD and also Red Cross, World Health Organization, according to a report that we have, that we've done research about the whole thing. So symptoms may appear 2 to 14 days after exposure. The major symptoms that you may be exhibiting or that may come through, that you may show when you see that, oh, I'm having that problem. The symptoms include 1, fever. The same person who has been exposed to a person with coronavirus or who has traveled to the locations that we've told you earlier, that about 60 locations globally. If you travel to those locations, China, other places, Iran, Italy, and you get in contact with people who are having that problem, and you see that, 1, you're exhibiting fever, At the same time, you are coughing continuously and shortness of breath, you can't breathe properly, then you need to take immediate steps. If you see that, I'm repeating the symptoms. If you the symptoms will last or may appear 2 to 14 days after exposure. So if you get exposure to coronavirus 2 to 14 days, it is likely that the symptoms may appear. Now, the symptoms that may appear will include, I'm repeating, fever, cough, and shortness of breath. If you witness those symptoms in your body, then it's likely you need to call your healthcare provider or healthcare professional if you develop those symptoms. So take note, it is very important. You don't need to stay home, or you don't need to keep the symptoms on you to make it too late for you. You need to call your healthcare provider as early as possible. Immediately you develop those symptoms, don't delay. Call them immediately so that your provider will give you the necessary instructions. Now, there are so many ways that you can adopt to be able to limit the spread of germs and prevent infection. According to Red Cross CDD, the following are the symptoms. I've told you the symptoms earlier, but the following are the limited things that you can do to limit the spread of germs and prevent infections. There are common sense steps we can all take to prevent the spread of any respiratory virus. Any respiratory virus, there are common steps that you need to take. Avoid close contact. Avoid close contact with people who are sick. Avoid close contact with people who are sick. If you see that somebody is developed, is beaten or certain symptoms, you need to avoid close contact. Not within 6 feet. Avoid close contact. If you see a person is coughing, sneezing, complaining of fever, avoid close contact. Stay home when you are sick. Stay home when you are sick. Cover your mouth and nose with a tissue when coughing or sneezing. When you are coughing or sneezing, you have to make sure you cover your mouth and nose with tissue when you are coughing or sneezing. It may prevent those around you from getting sick. So if you are sick and you are coughing, this is fundamentals that you use to prevent any virus. And you are coughing. You see, you don't need to you cough and then so close to the person, you coughing to the person. No. You need to all the time cover your mouth and your nose with tissue. Wash your hands often with soap and water, at least 20 seconds. Wash your hands very well with soap and water, at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. Always wash hands with soap and water if hands are visibly dirty. So if you go use a bathroom, you need to wash your hands at least 20 minutes. Wash your hands very well for at least 20 minutes. 20 seconds. Sorry, 20 seconds. Wash it very well for 20 seconds. You don't need to just go to the bathroom after using the bathroom, then you get in out to go eat, to go do this. My friend, it will help you. Make sure you wash your hands for 20 seconds. If you don't have soap, you don't have water available, use hand sanitizer with 60% alcohol in, so that you make sure that it kills all the germs. Avoid touching your eyes, nose, or mouth. Avoid touching your eyes, nose, or mouth. Practice other good health habits. Get plenty of sleep. Plenty of sleep. Be physically active. Manage your stress. Drink plenty of fruits and eat nutritious food. Those are fundamentals. Disinfect door knobs. Your door, the knobs of your door, disinfect. Switches, disinfect. Handles, disinfect. Computers, telephones, bedside tables, bathroom sinks, toilets, counters, toys, and other surfaces that are commonly touched around the home or workplaces. CDC recommend, it is very important that you undertake those steps to prevent yourself from catching any virus, any type of virus in your life. Use the, you see, when you're exposed to that particular virus, it's very deadly. And you can imagine that somebody traveled to Italy, and now the person has come to the United States. They tested a person, Rhode Island. They are saying he's having that problem. Is it not sad situation? So all the time, you need to take precautions to avoid having that problem. Coronavirus is creating serious problem, and you need to be prepared, because you don't know the people you get in contact with. But if you get in contact with somebody, you need to make sure that if a person is coughing, sneezing, and other things, you need to make sure you take proper care of yourself. You take proper care of yourself, and it will help you very, very, very well. Dennis Ansari, greetings to you. Now I'm giving the statistics again, the global death toll. According to reports, CNN has reported, major news outlets have reported, according to the report that we have, about 3,000 people have died globally from the new coronavirus disease. Now, as I'm speaking now, we have about 60 locations globally. They are all having, they have been infected. Some people have been infected in those locations. Now, Iran has reported or has confirmed 1,000 cases. Iran, 1,000 cases. Italy, 1,700 cases they've confirmed. United States, 88 cases confirmed. Worldwide, the whole world, 88,000 people worldwide have been infected with coronavirus. So meaning they are also trying their best to get medication for it. But as it stands now, they haven't got any cure now for it. So you need to take precautionary measures in your life to avoid getting into trouble or getting sick. You need to take precautions in your life to avoid getting problems. Now, those who had opportunity to understand what I said in English, I'm also going to Ghanaian dialect so that those who are also Ghanaians will get a clear picture of what I'm saying. I don't know, some are joining me, I'm eating at the daddy Fred. And some are cause of a coronavirus, you know. But the Nina Bremen who said the city. Coronavirus no yare bia. Amanfo ka ho asem pa sese. A ekosoro sese a ehu bebre abam ewo man bia mu sese. Sese a me no ka say, we are seeing nyina no nipa 3,000, the whole world nipa 3,000 and aba abonten say omawu as a result of the coronavirus. Nipa 3,000. That's only nipa 3,000 no. Sese a me no ka say, out of the 3,000 yenya ntie say Iran nipa 1,000 apem and oma confirm so manya sa yare ni bi. Oko Italy nipa 1,007 no oma confirm say omo so anya sa yare ni bi. We are seeing the whole world nipa 88,000 ne so manya sa yare ni bi. Na nya re hosem ya quarantine binum e de ka ho. Oba America nipa 88 and oma confirm say omanya bi. Nipa mienu awu afiri wiase. Na obi busa say ekwan ben so na coronavirus no efa so spread. Ye nim ni say coronavirus ni eye common ewo nipa dasani nipam na mmoa. Mmoa bi te say camels, ebi te say camels na e funu mu no hom. Ebi te say nantwie, ebi te say cats for instance cat cry de hen kra. Meow meow. So and na bi so te say your friend is saying but ya omene ne nam wie mo amataba ne nam wie mu ejinamoa ya cat nti bi to say cat ejinamoa na the woman say sha ase free China and as they say we are seeing in 60 countries and bi e wo say enti spread pa omunya nya aduro ma no omunya nya aduro emfa ma no na the woman say see as onya coronavirus ni bia na say obi oho na onya bia obeye den ni wahu se asomasi wanya bi me de bebre mo ena ekwan ye fa so spread ene se spread nipa ena de manipa na nipa de manipa no se wo ben obi 6 feet wo ben within 6 feet obo wagu so ana wo sinizi gu so a ebitimi enyam ene ntina o ma kire se nka be ya abere nyina so obi ana wo bo wa bi ana bibi se ya na wama interval bi abam kakra enti so obi na wo sinizi egu so a droplets no a wo so be home akomu no na akoma wo so wakonya bi na obi o coronavirus a wo be den wo musa asomasi o coronavirus wo be mo ansa wanya fever na afi wo bogwa e wo ma afi ontime home papa ohome ensisi so ni nyina ya nsenkyere ne ya hu se nipa no na ehya ase se o expose eba se okonya coronavirus ni bia symptoms ni ba between ase 2 to 14 days into wo fie na hu se sa ne ma ni bi koso na wanya fever wo ho abehu ane se wo bowa wo ho abehu ane se ohumi ensisi so a na ewo se utu anamon immediately na hu se de ebesi akọ na coronavirus adofodom de very serious okra wo mi ni se aduro no yenya aduro wiase na yenya aduro to mani abere o mo pa aduro na ekwan be na wo a wo hwe mi so befa so a wo be hwe ho yiye kakra afiri sa yare no ekwan no ebi ni se avoid close contact obi obi a susu ben no so bi yare obobo wa susu ben nipa no sa wo yare atenafie emfa wo yare ne nkonko spread emfa mo bia afi sa wo bo wa abere nyina fa tissue e cover no anasa ohene na bowa na se nkogum emma wanyi sa en na afi akogu obi so no esa wo de yare ni bi ekoma obi afi se obowa wi a e wo so timi ebomoden ohoro nsa na wa kasa so ko yisu bathroom a ohoro nsa at least 20 seconds na wo nsa so fa semina ni nsuo ehoro nsa se semina ni nsuo no ebi ni around fa hand sanitizer bi alcohol 60% wo mnya fa alcohol sa fa fefe da bia no wani ene wo hwene ene wanum ya emfa wonsan ntache too much ya gbo anhwe ni virus no betimi afa so akọ nipaduam ave wa kasa no hyase na didi yie na num suo na wo ho ayi adwendwene firi wo so na ya active kakra exercise kakra ebetimi aboa da bia so oniam e wo fie no bibi te se wo pono ye wo chim no di wura wo dan mu no bibi te se switch ade so wo kanea bibi te se wo computer wo use wo phone wo use wo table esi wo mpanchen wa kasa so wo ho a bathroom ne sink no toilet na toys a wo masoso mu asoso no da bia no disinfect on cleaning fefefe se be ya bibi sa entimi emma wakwan enti adofo no coronavirus no say eye ade a ekoso wo wiase ba bia na obi amampaye empaye na manfo obode na so bia so nyere no ho se anamo no so betu a obetimi ya protect ne ho ne nkrofo no protect ne ho se be ya abere nyina no and spread na bi nkokeka amanfo na say ya me no kasa yi nipa empem miensa na omawu as a result of yare ya aben me de besia me din de daddy friend me da bu nyina asesa mo join na me emrepam no ye besan akasa obia ne erade entena se makra mu nyina a very sad situation erade enka obia